Meanwhile, the World Health Organization has expressed some serious concerns over the current status of the pandemic. According to the WHO chief, the COVID-19 pandemic is far from over, as the Omicron variant continues to sweep across the world. Speaking during a briefing in Geneva, WHO's chief Dr. Tedros Adhanom said there were at least about 18 million new COVID-19 cases that had been reported last week, adding that the number of deaths remains stable for the moment. And yet there were some 45,000 deaths that were reported from the disease that are still being registered worldwide every week, although the Omicron peak appeared to have passed in some countries. Now, Dr. Tedros Adhanom warned that no country is still out of the woods.
Now is not the time to give up and wave the white flag. We can still significantly reduce the impact of the current wave by sharing and using health tools effectively and implementing public health and social measures that we know work.
Meanwhile, the United Nations Health Agency chief has warned against dismissing Omicron variant as a mild variant. The variant has spread like wildfire across the globe since it was first detected in southern Africa in November. The Omicron variant is much more contagious than the previous strains, but seems to cause less serious disease. The United Nations Health Agency has also cautioned against a narrative that the fast-spreading Omicron variant is risk-free. Now, Omicron is also causing hospitalizations and deaths, and even the less severe cases are inundating the health facilities. Dr. Tedros Adhanom said that there was an urgent need to remove the pressure building on health systems, especially in countries that still have very low vaccination coverage.
Omicron may be less severe, on average, of course, but the narrative that it is mild disease is misleading, hurts the overall response, and costs more lives. Make no mistake, Omicron is causing hospitalizations and deaths, and even the less severe cases are inundating health facilities.
The WHO has also called for greater vaccine distribution, as it has raised some serious concerns about those who are still not vaccinated around the globe. The comments followed those of the head of the emergencies, and he had said that if huge inequities in vaccinations and medicines are addressed pretty quickly, the worst of the pandemic could of course be over this year. Now, when we talk of vaccine inequity, believe it or not, just about 7% of the African population has been fully vaccinated. This, while over half of the world's total population has already been double vaccinated. Now, Africa's CDC Director John Ngasong has pointed out that the collapse of the global cooperation and solidarity with Africa over the last 2 years. Initially, wealthier nations had secured most of the doses of the vaccines available from December 2020 because of a lack of vaccines. Supplies to poorer nations have been very limited.
Over half the world's, if we look at the population of the world, in total, over half of the world's population has received 2 doses of vaccine. But if we look at in Africa, in our African regional office states, only 7%. So the reality is that the world is moving towards a 70% goal. The problem is we are leaving huge swathes of the world behind.
The statement from the WHO has come at a time when countries are struggling to contain an unabated spread. Europe's biggest economy, Germany, has also registered more than 100,000 new cases of COVID-19 infections in a span of a day, while other European countries are also battling soaring Omicron rates. France recently averaged almost about 300,000 cases on a day-to-day basis, while in South America, Brazil has registered a new record number of COVID-19 infections. Now, since the outbreak emerged in China in December 2019, the coronavirus has killed about 5.5 million people worldwide. WION is now available in your country. Download the app now and get all the news on the move.